Somebody asked me that how would you differentiate between Erbs paralysis and Klumpke's paralysis of the newborn. Some of the newborns who might have got a difficult labor, who are born as a result of a difficult labor, probably because of shoulder dystocia or maybe because of application of forceps, they might have some brachial plexus injury. So they might either develop Erbs paralysis or Klumpke's paralysis. So the question that was asked is that what is the clinical sign which can differentiate between Erbs paralysis and Klumpke's paralysis? So keep it in mind that one clinical sign, and that is actually a neonatal reflex that is present in the Klumpke's paralysis but not present in Erbs paralysis, that is Moro's reflex. So if the Moro's reflex is absent on one side, we call it asymmetrical Moro reflex. And you should know what is Moro's reflex. Moro reflex is a neonatal reflex which is present at birth and usually disappears between 4 to 6 months of age. So what you do basically in Moro's reflex is that you place the neonate supine, you gently raise the head of the baby while supporting the back, and then just you gently let the head of the baby drop backwards. You should keep your hand so that you do not accidentally injure the child. So as the baby falls back, as the head falls back, what happens is that there is abduction of the shoulders, and flexion of the fingers, followed by adduction. Now this is present on both sides, but if it is present on one side and absent on the other side, we call it as asymmetrical Moro reflex. And the side on which it is absent, it might be because of the brachial plexus injury, especially damage to the upper roots of the brachial plexus, which result in what? Erbs paralysis. So asymmetrical Moro reflex, in which the Moro's reflex would be absent on one side, is present basically in Erbs paralysis, but in Klumpke's paralysis, Moro's reflex would be symmetrical. The reason that in Klumpke's paralysis, the lower brachial plexus roots are involved. In Erbs paralysis, the upper brachial plexus roots are involved. So asymmetrical Moro reflex, in which the Moro's reflex is absent on one side, can happen in what? Erbs paralysis, or sometimes on unilateral clavicular fracture as well. And I told you that whether it's brachial plexus injury or whether it's clavicular fracture, it usually occurs because of difficult labor, instrumentation during the second stage of labor, like applying forceps, or because of shoulder dystocia. So keep this in mind: unilateral absence of Moro's reflex, either because of Erbs paralysis or maybe that side clavicular fracture in the newborn. Thank you very much.